Well, I am trying to record. Um, oh, there it is. I'm trying to record this video of a uh, discussion about um, orientation as we get ready to go to Stormont Vale West. So I'm going to try to do these in brief segments and share some ideas with you. Um, so Stormont Vale West is at 6th and Gage, and I will do a short segment to show you where that is. We are going to be having our clinicals there, and I know this is a challenging time for everybody, trying to work out our clinicals and what's happening. But let's make the best of it and try to be as supportive and helpful as we can to the people at Stormont Vale West. Stormont Vale West has facilities for adults and children, and it is a volunteer facility, so everybody there is expected to be there voluntarily. The kids are there because of permission from their guardians, from foster families if they're in foster care, or the state. They get help from one of those sources to get psychiatric care. Adults are there primarily because they have agreed to come into the hospital. The stay is about an average of 3 days. Sometimes you get people who stay a few more days, but mostly it's just 3 days. The units are locked. When we get there, we will come to the unit at 6:50 in the morning. We start out there because at 7 o'clock they have report. And so we're going to start out at 6:50 on our first days for my groups. Hopefully your people for the other groups, Kristen, Shelley, and Lindsay, will let people know what time they're to start. I think they usually start about like at 7, but they'll give you more detail about that. We will start in the morning. You have report at 7, and then you spend the day with your clients. We're not going to be doing things like passing out medications. We'll do some procedures, but primarily I want you to be checking with staff about how to be helpful. We're going to ask people to put things like cell phones away. So you don't want to have those out on the unit or in meetings. You only get those out when you're either back in the break room or in case there's some type of emergency. But you don't use those to check on anything. You don't check on medications or things around the clients on the units. So we'll put those cell phones away. But you'll be with the patients. You'll be in the day rooms. You'll be in activity areas. You'll go with them to meetings. You'll go and observe them as they interact with each other. The adult side has a opportunity for a meeting at 10 o'clock, and I will help lead that. It's usually about 40 to 50 minutes long, and there's an opportunity possibly for the students to help lead a meeting when we're there for more than 2 days. If our groups are there for 3 days, 2 of my groups are there for 4 days, and there might be an opportunity for a student to lead a meeting. But right now, you'll be able to observe that meeting. And that's a lot of what we do is observation. So again, I want you to be aware of things like attitude. I want you to have a positive attitude about yourself, about the clients. As we're there representing Washburn and helping Stormont Vale. So we're also kind of a representative of Stormont Vale while we're there. We, again, will have an opportunity to observe what happens, to see what happens in a psychiatric facility, to learn about people's diagnoses, and what kinds of things they come in for. Primarily, people come in because of depression and anxiety. You might see some schizophrenia, some bipolar illness. The children will have those struggles, sometimes conduct disorder, sometimes oppositional defiant disorder, attachment issues. So we'll be noticing what their diagnoses are and what we see. The interesting thing is that we, most of the time, will see what looks like regular people who are just there, doing their activities, doing their day-to-day things. We learn more about their struggles through their history, the things that we hear and report. But I want you to observe for that. There's a few specific things I want you to observe for. And I'll go into more detail about that and share more information. But things like impulse control, how do they deal with their impulses, their moods, judgment. And this is not about are they judgmental or of others, but do they use good judgment in decision making? Self-perception, self-esteem. Many of the people will have had struggles with feelings of self-harm, of wanting to hurt themselves, wanting to kill themselves. Where are they at right now? What kinds of things do you see? Reality testing. Are they struggling with hallucinations, with delusions? People in manic phases will have difficulties with that. People with schizophrenia can have problems with that. People may tell you that they have these symptoms, but you may not notice much difference. Occasionally you'll see some people who are delusional, who talk about conspiracies and people being against them. They will display fearful reactions, paranoid reactions. We'll want to look at their connections to others. How do they talk about the significant people in their lives? Missing family members. Who do they describe being connected to? How do they interact with the people there on the units? Thought processes, similar to their judgment, but this is expressed through their communication. How are their memories? Are they able to express themselves? Are they able to communicate their ideas? Competency. This one would be things we might ask them questions about. Are they able to take care of themselves, their clothing? Can they fix themselves meals? Some of the young children, that's not developmentally expected. But some of the older kids may have had experience with that, may feel burdened by that. They may do a lot of those things for their families. So we would see things like them going to the cafeteria and how maybe they choose food and consume food. How do they interact around meals? Stimulus barrier. When there's disruption, when there's maybe some type of sound or activity, how do they respond to that? Are they able to get focused back on the activities that they're being asked to do? So these are examples of really focusing in on our observations. So being able to see clients, see how they interact with staff, how they interact with us, is going to be an important part of the work. So I'm going to ask that people be aware of that. Sometimes people are concerned about communication and how when we talk with people, people are afraid that I may say something that will upset people. And the opposite of that is not usually the case. People are seldom believe that they will say something that will make the person just great, that they will cure a person through one word. But the other, that fear is common of, if I say something that might set somebody off, it might ruin their day or really send them over the edge. Again, that's a common fear, it's understandable. But if we use things like communication techniques of listening, of regard for them, kind of empathizing with them and their position, what's happening for them, that goes a long way for helping them. We want to listen, we want to be patient, we want to have kind of a thick skin, that we don't take comments or reactions personally. They don't know us very well, and so if they are upset, it's usually not about us, it's about something else. Now, we might remind them of somebody. We call this transference. And they might remind us of somebody. That's called countertransference. But seldom is it because of the relationship. It's about other things. But for the most part, those kinds of disruptions don't happen. So again, if we are aware of our attitude toward people, that we're there to help, to listen, to be supportive, that can go very well. The clients there appreciate that nursing students are interested in them, are willing to be around. And many times, nursing students have more time to sit and listen and interact and do the activities with the clients. On the adult side, they tend to work on puzzles. Sometimes they color. On the kid sides, many times they have worksheets and things that they're working on. So helping them understand a question, just kind of encourage them as they're working on those, can be very important. So again, I do understand worrying about our communication and how people receive us, but if we use like customer service type techniques, if you've worked at other places, how can we be a supportive, helpful person in this setting? And again, asking the nursing staff, what can I do to help? What can I do to help out? Have that general attitude can go a long way. Staffs are going to be stressed, as well as the clients, because of the coronavirus situations. So we need to be aware that that can happen, and let's do our best to help make things go smoothly. So I'm going to I'm going to make another video about the facility and share that with you soon. Thank you.